one that I only you said I could do. Stand. That's what you do, babe. Things that go through and you're going anywhere.
The Truth with Gwen Azama-Edwards.
State Street. Yeah, that's right.
So, Gwen Azama-Edwards, retired city clerk, former city commissioner, City of Daytona Beach. The Truth with Gwen Azama-Edwards.
Stan, you've been sitting much too long, much too long. Welcome, 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 welcome to Truth, the radio program designed with you in mind, a program whose sole purpose is to empower you, our listeners, for information leads to knowledge, and knowledge is power. And as always, we want to empower you to take control of your life, those things that impact you, your family, and your community. As always, too, I want you to go to the website at www.gwen-truth.com so you can access all of those all-powerful links that will get you to all that all-powerful information that will give you the powerful knowledge that you need in order to be able to take care of business, right? Take care of business for you, your family, and your community. So go to the website at www.gwen-truth.com. Also go there so you can take part in the query that we still have going, asking about the economy. You know, it was starting to do pretty good, and then we had this sequestration, and then we had, you know, the government shutdown, and then, you know, who knows what's coming next, but all of that impacts the economy, hurts the country, and impacts all of us as well. So your answer might be a little different today than it was a week, 2, 3, 4 weeks ago, but I do want you to go to the website so you can go ahead and chime in on that. And then, you know, you can kind of screw the results one way or the other based upon how you respond. As has been stated, I'm Gwen Azama-Edwards, former city commissioner, retired city clerk, City of Daytona Beach. And I'm here for you. And this is about truth, and it is about sharing knowledge, sharing honestly and accurately what is out there, what's going on, and what you need to know. Again, to empower you, right? Amen, amen, amen. We have been, you know, talking for several of my shows leading up to tonight concerning the Affordable Care Act, the Patient Protection Affordable Care Act, and affectionately known as, by those who love it, Obamacare, those who hate it, Obamacare. But we're encouraging, and a shout out to all of those who have been able to enroll in the program. I know it's difficult. I know, you know, with everybody trying to get into the system, that it takes a lot of patience. That's something that, unfortunately, we as Americans have very little of. But I ask you to please hang in there and check it out. Get the information that you need to see if that's something you qualify for, your family qualifies for, or a friend or someone else that you know qualifies for. And let them also go online or make the phone call so that they can get enrolled in this health care program, this affordable health care program. Now tonight we're going to talk about Medicare, and a program that helps the seniors as well in line with that. But we're talking specifically tonight about Medicare. And I've mentioned at prior times that Medicare has some of the similar, you know, enrollment dates and the like, and there are some kind of similarities in a way, but we're going to talk about this program, Medicare, which I can talk so easily and well about. I said that to our guest, Judy Hahn, who is coordinator for Volusia-Flagler County for a program called S.H.I.N.E, and we're going to tell you about that as well. But I've just gone through the process of signing up for Medicare, which doesn't kick in, of course, until January 1. But I've gone through that process, and so I have questions, and I know that you all who are like me, you're 64, you're getting to the point where you're 65, that you've got questions too as to what it is that you can and should do shouldn't do. We're not going to tell you you gotta do. We're just going to share information with you tonight. And again, I'm so grateful to have the guests that I have with us tonight, Judy Hahn. And we've got some questions. We've got some areas because, you know, this is only about a 50-minute to an hour program. And so all we're going to do is really kind of hit the tip of the iceberg in terms of all the information that's there. But to try to give you enough information so that you can then go online or you know, talk to someone. I talked to my sister, my older sister. She hates me to call her that, but she is my elder sister. But she's on Medicare, so I talked to her about, you know, her experience and what she did in the process and all. And that was very informative, actually. And, you know, as I read and did everything else, I was able to make my decision in terms of what direction I was going. And again, we're going to just share some information that will help you in some of that decision making too. And if nothing else, kind of whet your appetite so that you can go and get the other information that you need. Right, Judy?
Right.
Okay. And again, my guest is Judy Hahn. And for those who will go online so that you can see this videotaped, because I do videotape these and I upload them to YouTube so that you can actually see what you're hearing. But Judy is a S.H.I.N.E representative, and Judy, I'm going to ask, we were going to start with a brief history of Medicare, but let's start out first sharing with people what S.H.I.N.E is, what the acronym S.H.I.N.E, S-H-I-N-E, stands for, and a little history about S.H.I.N.E and what it is that S.H.I.N.'s overall goal is in terms of our seniors.
Okay. Well, S.H.I.N.E is one of the SHIP programs. SHIP programs are available in every state and the U.S. territories, and they're handled somewhat differently some places, but they all are helping seniors. S.H.I.N.E, the acronym S.H.I.N.E, stands for Serving the Health Insurance Needs of Elders. Now, we call our SHIP program S.H.I.N.E because the acronym SHIP was already taken in the state of Florida by a first-time homebuyers program. So that's why we picked S.H.I.N.E. We thought it was, first of all, appropriate to Florida, and of course we do help seniors with their insurance or Medicare insurance needs. In recent years, we've also begun, since there are so many disabled people on Medicare, we started helping disabled people as well because they face the same issues that our elder citizens do. So we help both. And our mission is to help people we're totally unbiased, we're not paid, we're volunteers, we have no axe to grind, no particular insurance company that we're in love with. We just give them the information they need.
Because you're not allowed to recommend, right?
Right, and they need to make their own decision. We're S.H.I.N.E counselors. And counselors only give you the information and let you decide for yourself. So that's what we do.
Wonderful. And I think I've shared on previous programs with our listening audience that I did go through the S.H.I.N.E training. And we're going to give you an opportunity to get the information you need. So if you want to become a S.H.I.N.E volunteer, you can do that. And they are in need of volunteers in our area as well as, you know, around the state. But we're just talking now about our area, Volusia-Flagler County. And you actually service that area.
That's correct.
Yes.
We do. Actually, I'm very short on Volusia volunteers right now. So I am handling, on Monday afternoon, I go to DeLand. On Tuesday afternoon, I go to Ormond Senior Center. On Wednesday morning, I go to the Elder Source office in the DCF building. On Thursdays, I go to either the Council on Aging or alternately the Aging Tree over in Orange City. And Friday, I rest.
You probably need it after all of that,
that's
Judy. Goodness gracious. Judy and I actually met each other because we were both serving on the Elder Source Advisory Council, which is another program that looks after the needs of the elder population. And I've enjoyed serving with her on that as well. So, you know, we get around and we're really doing some stuff to try to make sure that our elder community, which really is a large number, represents a large number in terms of the population in Volusia County.
Very large. As a matter of fact, if you add Volusia and Flagler County together, Volusia County has 115,000 Medicare recipients, and Flagler has approximately 10,000. If you add those two together, we have as many as all of Duval County, 125,000.
Wow.
Yes.
Wow, absolutely.
It's amazing.
Yes, yes it is. And for those who, I started out talking about the Affordable Care Act. Now, individuals who are a part of Medicare, who qualify to sign up for Medicare, they really and truly need to, and I've even heard that they are required to go ahead and sign up for Medicare. The Affordable Care Act is not meant to take the place of Medicare if that's the program that you're to sign up for. And you know, to keep this kind of running in that same vein, Judy, I was doing some survey calling for follow-up for Elder Source, and I found out that there were individuals, and I recently went to some training, found out there are individuals who actually have both Medicare and Medicaid. Could you share with our listeners how someone might end up in that kind of a situation?
Sure. Some people, and it's mostly the lower income people, of course, that need Medicaid as well, but there is no problem having Medicaid and Medicare. It is something that's determined by the state, and so DCF, of course, is involved in Medicaid. Medicaid is a state program. Every state is different with Medicaid.
Mm-hmm.
If you come from another state, don't expect Medicaid here to be what Medicaid was there, because they don't have to be similar.
Mm-hmm.
The only thing is that they're partially funded by the federal government. Other than that, Medicaid is to Florida what Florida Medicaid is. That's it.
Mm-hmm.
And what has happened is there's quite a few Advantage plans that have Medicaid and Medicare coverage,
Oh.
so that if you qualify for both Medicaid and Medicare, if you're dual eligible,
Mm-hmm.
then you can get one of these special special needs plans, and they might help you with it may be something, it may be a chronic illness that you
Mhm.
have,
Mhm.
or it could be just the fact that you're low income and can't afford other things. So either way, the special needs plans help a special niche of people, and if you think you fall into that area, it's always good to find out, because you would not know that you've qualified for Medicaid unless you applied.
Mm. And so that you all know too, because we've talked about S.H.I.N.E, S.H.I.N.'s volunteers will help you to get information, get some answers regarding what we've just talked about, what we're talking about in terms of Medicare and the like. And you can contact them.
I think you've got my phone numbers.
Okay, do I?
Yeah, I've got one of them right here. This is the main line, and that's 1-800-96-35337. That's 1-800-96-ELDER. And
Oh, okay.
that goes through the Tallahassee phone system, but actually when they see our area code, it routes to Jacksonville.
They route it,
Yes,
okay.
so
So it goes into a central calling
That's correct.
system, and then they route it depending
That's correct.
upon
So
where the
we'll go
person
to
resides.
Jacksonville, and Jacksonville then sends me their all the calls that come in from Volusia County, and they send. I have a great local coordinator in Flagler County, Carol S.H.I.N.E, and she will route the calls to her people in Flagler County.
Okay, and I do have that card, and the contact is 1-800-96-ELDER, and you have the 4 numbers for ELDER? What
Yes,
it
I gave
converts
them.
to?
You want to figure? I know it's so
Yes.
hard to figure out, isn't it?
1-800-96, and you said 356. That's okay, you'll get it. We'll get that for you. And but you said, or they can call
They can call that.
1-888-242-4464.
And that does go to Jacksonville.
That goes to Jacksonville, and then
Straight
they.
to Jacksonville.
Okay, okay. And is that where they will reroute it as well, or no?
No, they don't have to. Then they can answer the questions, give you, if it's a resource that you need, not really the Medicare assistance, they can help you with some other resources.
Okay.
And that elder helpline, that first one that we gave before,
Mm-hmm.
is 1-800-963-5337.
963-5337.
Right.
Okay. 5337. Okay, that's 1-800-963-5337. Okay,
Yeah.
that spells out elder, so you don't have to look it up on the phone. But these S.H.I.N E volunteers are very knowledgeable. They are continually updated with new information, so that you will always get current information when you contact them. And I'm not going to take our questions. I'm going to ask as we get along, but we're talking about the baby boomers, and there are so many like myself. I'm considered a baby boomer, I'm sure. But like myself, who are reaching that point where they're 64, they're getting ready to sign up for Medicare, and I can tell you, I don't care how smart you think you are or how educated, I got a BA and an MA and all that kind of good stuff, but when it comes to health care, people really get concerned about making the right decision. They get anxious, they get really a little frightened, because I can just share with what I went through as a person who had to make these decisions, and I, what am I going to do, all this kind of stuff. And just to share with you, once you're, and I would suppose that's if you're already signed up for Social Security, you will automatically get information that will be mailed to you, correct?
Yes.
Yes.
You should, but don't, if you're getting to be getting close to 65, don't wait on it.
Yeah,
Go online.
go online, go online, or I guess you can call Social Security as well, right?
Yes.
Yes, but if the enrollment period is 3 months before your birthday, 3 months after.
And the birth month. So
And
it's
the
actually
birth
7
month.
months. Yes. So
Okay.
3 months before your birth month, all of your birth month, and then 3 months after. The only caveat there is you want to, if you possibly can, you want to sign up before your birth month is over, because if you don't, then you won't get the benefits starting right away. So if you sign up before, you'll start. If you sign up any of those first 3 months, you'll start on the first day of your birth month.
Right.
If you sign up after that birth month, then it's going to delay it like 1 or 2 months down the road. So you want to be proactive. So that's why you've got 7 whole months. You can get it figured out, really, if you get in touch with a S.H.I.N E volunteer, or read or go online, whatever.
Yes, and because my birth month is January, so effective October, I needed to make a decision, starting then, even though I had till, let's see, it didn't include January, so February, March, April, through April, the end of April, to really decide, but I don't want to wait that long, The other thing is that since my birth month is January, if I really wanted to make sure I made a decision by December 7th, is it? December 7th?
That's open enrollment.
Yes, because I wanted to make sure that it started that first day of the 1st of January.
Right, and anybody, I believe I read in the paper today, anybody that enrolls during open enrollment that is eligible to enroll during open enrollment and is worried about the Affordable Care Act, as long as their Medicare plan starts on the 1st of January, they don't have to worry about the Affordable Care Act.
Oh, okay. Okay, wonderful.
So even if you were like the 31st of January, as long as you had signed up to be starting January 1st, you're okay.
Okay, wonderful, wonderful. But there are some other issues and concerns that might go through your mind. You want to make sure, number one, that you get it done timely. If your birth month's January like mine, then you wanted to get some paperwork in by December 7th. And you also want to make sure that you're getting the kind of coverage that you feel you need. Because as Judy, as you and I were talking, every case is different. My sister, I hope she don't mind me talking about it, but I'm gonna tell her anyway. Because she was a nurse, she retired from the nursing with the Nursing Association, which was a union in New York. And when she retired, she got everything for Medicare, through Medicare, the A, the B, and the D. But she didn't have to do anything. She automatically, because of the union, became a part of an Advantage program. And so she never received anything, she never had to do anything. If she didn't want to have Part B, she could tell them that, because that comes out of your Social Security to pay for it. But, you know, if she didn't object to having anything, it automatically fell in place. And, you know, she's pretty happy so far. She is. But decisions do need to be made in terms of the A, the B, the D. If you want it all, you don't have to do anything. But that's if you're already on Social Security or whatever. Talk us through a little bit of that, Judy, in terms of what is going to happen. Because as I said, I did, because I was already drawing Social Security, and I was already advised that if I didn't get information by a set time, you know, like beginning of October, or the last week of September, then I should call somebody and make some contacts. But I did. I got it in time. I actually got it, I think, the second or third week of September. Got basic information. And they were saying you should go online, and then I got a letter that said I should go online and set up the My Medicare, blah, 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 blah. But I waited on that. I waited till I got more information, and it was kind of a good thing that I did wait, because as it turned out, I didn't need to do that. So, talk people through what these different parts, you know, alphabet soup as they call it.
They do.
You know, parts A, Part B, Part D, there's a C, you know, what that means, what it kind of service it represents for individuals. You know, it's like with the ACA, and you got the metallic soup of the bronze, the gold, the silver, the something else in there. Platinum, right. Platinum is the highest, yes. So, you know, but the A, B, C, D, you know, all of that stands for something different. So share with our listeners what it is that's involved with that.
Okay. Well, Part A is the part that either you or your spouse has worked for all your life and paid for already, and that's the hospitalization part. Now, in today's market, that hospitalization part, and this is just something to know for a little bit later when I'm telling something else, is worth about $450 a month.
Wow.
And then Part B is the part that's for doctors and labs and that sort of thing.
Mm-hmm.
And that comes out of your Social Security, and this year is $104.90. We have not heard yet what it's going to be.
And each year it changes.
It can change.
From what I gather, the last 2 years it's gone down.
Yeah, because last year I think it was like $115.90 some people were paying. And this past year everybody's been paying $104.90. But I don't have any idea what it's going to be this coming year.
And that is taken directly out of your Social Security check.
Yes. And those are the two parts that formed original Medicare. And that started back in 1965. So it's been a program for close to 50 years now. And yet I think that's such a short time, because it seems like it's been around forever.
Yes.
You know, so I was so surprised when I saw 1965. That can hardly be. I have older kids than that.
Absolutely. And now A is automatic, but B, if someone...
A is automatic unless you didn't have 40 quarters of work experience. And if that's the case and you want the hospitalization, then you would pay a certain amount of a premium. So that's just something to know, just in case. Happens to very few people.
Right. But if you're getting Social Security, unless you're getting some special type of special program through Social Security, but if you're getting regular Social Security, you satisfy those 40 quarters, whatever.
Right.
Yes. Okay.
And then the Part B is like I said, is the doctors and labs and that sort of thing, and that is the $104.90. I believe I don't want to correct you, but I think that your sister is probably also paying that $104.90.
Yes, she does.
Because she's in an Advantage plan.
Yeah. When I say she didn't do anything, they automatically take it out of her Social Security. Okay. So yeah.
Because anybody that's in an Advantage plan, and I'll get to that in a minute, has to pay the Part B premium.
But if you don't want that, and we don't know why anybody wouldn't, but
Really.
if you don't want it, you have to tell
yes,
them.
You do. Yes,
Otherwise, you automatically get it. And the reason you have to tell them is because they're going to be pulling that money from somewhere
Right.
to pay for it. You can say, I don't want to do it. But for those who might be thinking about not doing it, think twice.
Right, because it's not very much money for quite a bit of protection. And as Gwen and I were talking before, Medicare pays 80%, basically, 80% of your health costs. Well, in my math, that means 20% you're not.
That's right.
You're on the hook for. And that is pretty much how the supplement plans came about, because the insurance company saw that there was a market, a need for a policy, a supplement, a Medigap, there's all these names for it, but that kind of insurance that would cover the 20% of different things
that out of pocket
exactly.
costs. Yeah.
Now, continuing with the alphabet soup stuff, the plans that are supplements are A, B, C, D, F, G. Not every letter is represented, thank God, but the policies are actually named for letters, and so each policy has to have the same, has to cover the same things by the federal government guidelines. They have to cover the same things. The difference is that every policy can, since every company is bidding basically for your dollars, they can charge whatever they want. So it basically makes no sense to go and pay more for the same supplement, the same, say, N policy. It wouldn't pay you, it's no better policy if you're paying $200 a month or if you're paying $150 a month. There's no, the only better part is you got $50 in your pocket that they don't have.
Right.
So that's the thing about supplement plans. They're also quite pricey. The only time that you are guaranteed issue to get a supplement policy is when you first apply for Medicare. Other than that, it's issue age related, and it's also by the insurance. If the insurance company looks at you and says, I don't want you, you're going to need a kidney transplant, they don't have to take you after that first time. So if you want to elect to get supplement insurance, if you can afford it, the time to do it is when you first qualify for Medicare, first eligible for Medicare. Then that's A and B. C is a totally different road you're going to travel down. That's the Advantage plans. The Advantage plans came about because a whole heck of a lot of people couldn't afford the supplements to go along with the A and B. And so the government contracts with insurance companies and says, here, we're going to give you her $450 that her A is worth and her $104.90 that her Part B is worth, and we want you to manage her health. And that's why on Advantage plans you have things like gym memberships, curves, Zumba classes, all that kind of stuff, because they want you healthy. They have diabetic classes, they have nutrition classes, everything you can think of to keep you healthy.
Smoking cessation.
That's right, because it's to their advantage. Your bottom line, which is your good health, affects their bottom line, which is their good health fiscally. So it really matters, and that's why they're so proactive on keeping you healthy. So that's, and also the Advantage plans or the Part C usually come with a drug component. So you don't have to go out and purchase a Part D, which you do have to if you've got the A and B and a supplement. That you need to have a drug plan. And the drug plans came about sometime in the early 2000s. I don't remember the exact date, but in the early 2000s. So the drug plan hasn't been around all that long, but if you think back on the history I've kind of related here, you can see a lot of similarities between the Affordable Care Act
Yes, I was going to say that.
The evolution of Medicare, because it's the same sort of things, and people were saying the same sort of doomsday things back then about Medicare, that it was going to bankrupt the government and all those sorts of things. And
Mhm.
Part D was so awful, and why do you have to be in it, and all kinds of stuff like that. And it's the same thing today. So hopefully,
and it's been around for 50 years almost.
right?
Yeah.
And hopefully, I think that everything will work out. As we go along. It's not going to be perfect right away. Nothing else was perfect right away.
Right.
So
Absolutely.
I think that
and as you go along, different parts of the bugs and
Right.
stuff will work itself out.
Right.
Because as with that, you have the 3 months before, 3 months after for the January start date
for
Affordable Care Act.
Yeah.
Yeah.
Their enrollment's a little bit different. Times,
Yeah.
a little
Yeah. And you have as I said, the different metal
Mhm.
programs that you can choose depending upon how much money you want.
Right.
But as you said with Medicare, each of the programs has a minimum of
Mhm.
12 things that have to be in all of the
Right.
programs.
Right.
Yeah, it just depends upon how much copay and the like you want to
And I'm kind
take
of
on.
wondering if it won't encourage the same sort of insurance competition that the original Medicare did with the supplement plans, because
Mhm.
what I'm reading is that your copays or your percentage of what you're paying can go up to like 60%,
Mhm.
and so I'm thinking that's kind of scary.
Yeah.
So maybe there's going to be some sort of a supplement in there that
Mhm.
you can purchase,
Yeah.
So
And
makes
and
sense.
and that's for those who choose the lower level.
Right.
But you go up to the bronze and you're paying little or nothing in terms of your part of it, as opposed to the part that the insurance people will be taking care of.
Well, you either pay at the beginning or you pay
at the end.
Yeah,
Right.
you are always going to pay, and that's just really the bottom line and how you have to think about it.
Mhm.
It's just, are you more of a gambler? Are you more of a let's go along to get along?
Yeah,
So
and
it just depends.
those who are the healthiest would
Mhm.
probably get the ones where they would
Need
pay
the
the
least,
larger
right.
share up front, as opposed to letting the insurance company do it,
Right.
as opposed to those who have really the pre-existing and the like.
Exactly.
You really want, because even at that, with what you end up paying, you're still paying a lot less than you were
Right.
paying in the former market.
Right.
Yes.
And even if you're a low-income person and didn't have insurance before, what I always thought was horrible was the fact that the hospitals and all would charge you the most they could. And so people who had insurance, the insurance took care of it, and so they didn't have to worry about if a MRI was billed out at $600 or $1,000. They didn't really have to worry about it because the insurance company was only going to pay X number of dollars,
Right.
and they were going to be satisfied with it.
Mhm.
But the low-income people who can't afford it, they bill them $1,000, and then they're on hook for $1,000. They get no break.
Yes.
So to me, it's not quite right.
It wasn't right, it wasn't fair. And a lot of that actually went on, not just for poor people, but I know of people who had insurance, and one went to this person and they charged X, Y, Z, and they went to another person and they charged, and there was such a disparity
Right.
between what was being charged and what we're seeing as a result of what's
Right.
happening in,
Right.
with Obamacare, is that there's a leveling off. There's,
Kind of like what the market could bear in a
Yeah.
lot of cases. Yeah.
Absolutely. So we've got more of things being very transparent too, in terms of what's there and what's being charged. And one of the things that I'd asked my sister, because I've gone through all this training, and I know with Medicare that there's a new summary sheet that you get now, certain people get, that outlines, you went to a doctor, this is what he said he did for you, this is what he charged, this is what we paid, this is what you paid. But she said, I've never gotten any of that. I said, oh, surely you just probably don't even know. Well, with the Medicare Advantage plan, you don't
Right.
get all of that, because the company
Is paying
takes
off.
care
Yeah,
of
that's
all
right.
of that. They pay for it, they take care of it. They're the watchdogs in terms of what's going on
That's
with the
correct.
system. But for those who are part of the original
Mhm.
Medicare, they need to keep an eye
Yes,
on.
they do, because of the fraud.
Right.
Because you can have a doctor bill, and sometimes it's not the fault of the doctor. I know of people who have just been, the fee code is
Mhm.
wrong. There was a glitch in either between the office and the doctor or whatever, and sometimes things get billed out wrong. And if you see that you got charged for an office visit that was 2 hours long, and you were there 5 minutes, you know, you got to say something, because that part, that either could be fraud or carelessness or just a mistake.
Right.
But you need to let somebody know.
Because it ends up costing the system.
Absolutely, costing all of us money.
Absolutely. And Florida is one of the states that has the highest amount of fraud in terms of Medicare, Medicaid.
Right, particularly in South Florida, but even here.
Absolutely, absolutely. So, in terms of our Medicare with the A, B, C, D, A being
the
hospitalization, which when they take Medicare out of your paychecks, that's what that's going for, okay? B would be your
doctors and labs, all that sort
all right, okay. And that's the one that where they will take the money out of your Social Security check. And you don't have to worry about that, but if you don't want it, and hopefully that's not the case, that you won't make that mistake, but if you don't want it, you let them know, and then they won't do it, so you won't have B. Now, in order to sign up for an Advantage plan or some of the other programs, they require that you have both A and B.
Yes, that's correct.
A and B.
Right.
My sister told me of a friend of hers who didn't sign up for B. There was some kind of a misunderstanding, and I said, God,
it's
I
easy.
don't know.
And when I've seen some of the letters that the government sends out, the you know.
And she didn't want it. She didn't at the time. I think there was something about her signing up, but at the time, whatever happened, she didn't get it. And she tried to go to this doctor for some health issue that she had, and the doctor told her, "No, I can't see you. I'm not seeing you because you don't have Part B." She said, "What is that? Why do I not?" And I told my sister, with all the information out there, but you know, you can have buku information, but if people don't read it, they don't understand it or whatever. That's why S.H.I.N.E is so wonderful. But if they don't, then they don't have the benefit of understanding why that's so important. So she ended up then going back trying to get it, and share with them what happens when you don't get it the first go around or the first opportunity.
Well, you're going to end up paying a penalty. You're going to pay a penalty, a percentage of the premium for every year that you didn't sign up. So if you're a year and a month, you're going to pay a penalty of a year's worth of penalty. And
you end up getting it at a higher rate than had you done it first time.
So if it's, I don't even know, if it's $104.90 and your penalty is $10, then you're going to pay $114.90 this year. Next year, if it goes up, you're going to pay more. So you've got that, and that penalty goes on for, I believe that one goes for, I don't want to say for certain. I don't want to say for certain because I don't want to say anything wrong. But there's definitely a penalty involved. There's also a penalty for Part D. That penalty, I know for a fact, never goes away.
Yes, that's the one where you will continue to pay a higher amount because you didn't take it. So the best thing that that a friend of mine told me, even though she had a health care through federal government, and her sister told her, sign up for everything you can, A, B, D. And the best thing you can do is to go ahead and sign up for these, and you know, if you decide later, there's a time when you can make some kind of a change, and we'll talk about that. But it costs you, and you're penalized if you don't do it when you should, when you first start. And when I say sign up for D, in actuality now, if you're on Social Security, you're going to automatically, or you should, get information, etc. And they will go ahead and say you got A, B. They will send you a card that says you got A, B, unless you tell them you don't want B. And when you're in an Advantage plan, they provide the D coverage.
Ordinarily,
yes. Ordinarily. Some don't have that.
That's true.
So you want to check. Yes, very few. Now, and let me just say, you're listening to Truth with Gwen Azama-Edwards. This is WLE, BIG, Big, 1380 AM on your radio dial in Ormond Beach, Florida. And my guest and I, Judy Hahn, and I are talking about Medicare and what it is that you need to know, what it is you need to check on, etc. And Judy, as we talk about this, and I was talking about the information that I started to get, and by the way, guys, you're wondering like what plans are out there. They're gonna bomb blast you with all kinds of information from every possible opportunity you have to, take the supplemental and supplements and supplementals and the like. But never fear. S.H.I.N.E is here. Number one. Number two, if you're computer savvy, you can go online. But I can tell you that I did that, and sometimes you get even more confused. Sometimes more information is even more confusing, okay? So S.H.I.N.E is great for you to check on. And, if there's a company that you think you might want to go with, as with me, I was with Florida Healthcare with the city. And I love my doctors. That's the other thing you want to look to see if your doctors are included in the plan that you select.
Right.
All of the doctors are still with the plan that I decided I wanted to go to. But they had two different plans, So I'm going thinking, okay, which one is better, etc. So I made an appointment. I sat down and I talked with the individual to answer some questions. And found out that, by the way, guys, Medicare does not provide dental coverage. Now, depending upon if you're in an Advantage plan, there are like 3 opportunities, like a hip replacement or a couple other things where I was told that they might do something in terms of dental. You were in an accident or something, of course, that's covered. But otherwise, you need to have a supplemental dental plan, which I purchased, and through my Advantage plan, I was able to get that for $11.99 a month. And even at that, they had a couple of different plans to choose from. But, like point of service and all that kind of stuff where you can actually, see doctors outside of your network. Okay, dental is not covered. And the other thing that's restrictive type of coverage is your vision and hearing.
Mm-hmm. Usually if you see in an Advantage plan, if you see that they have vision and hearing and dental or any of those, you're going to be, I would say mostly for vision, you're probably going to get an eye exam a year, not classes. You're going to get, and for dental, you're probably going to get a couple of cleanings a year. For hearing, you're probably going to get your hearing checked. That's about it. That's really just about all they cover. Unless for some reason that policy has something as an incentive that's almost like a rider would be to a policy.
Right.
So other than that, it's going to be very bare bones.
So, and additional services that you would get or pay for healthcare, you would get, as I did when I purchased a dental plan, that's called a supplemental. To, the Medicare. It's separate from Medicare, so I already signed up for it, so I'd have it ready, But you said that there are also supplement.
Right.
Supplements.
The supplement plans are the ones that I spoke a little bit about before. They're by letters. The policies are named for letters, and each policy has to have certain criteria that the federal government sets. In other words, some plans may cover your deductible for the hospital, your deductible for the doctors, hospice care, care for you if you're in a foreign country, all those sorts of things. So you pick and choose.
Long-term care.
No, not long-term. Is a different animal.
That's a totally different animal, guys.
And believe me, if you're at retirement age and you haven't done anything about long-term care, it's probably too late.
Because it would cost so much that you just couldn't.
Yes.
And that was the other thing that you and I were talking about too, that as with myself, I'm really healthy. I mean, just very, very healthy. But understand that the body does, start to deteriorate as you get older and older and older. So when you select a plan, even though you want to select it based upon where you find yourself now, and you don't want to pay for something that you don't feel you need, but understand too that as you get older, you may need different types of things, additional things, different supplements and the like. To be added to that if you're able to afford that. So do keep that, kind of in mind as well.
I'm sorry.
As you go through this process of signing up for what it is that you want in terms of Medicare, And if that's signing up if you want a Medicare Advantage plan, but if you want the original, you know, depending upon where you are, your situation, you get that without doing much of anything. And then there are some people, as we've stated, that can get both Medicare and Medicaid depending upon special circumstances and the like. And there are people, I remember a few years back when some of the healthcare providers dropped our area. You know, they dropped people in the area. They decided they were no longer going to provide service here. Never fear, because when that happens, if you're signed up for that plan, then you're given a special enrollment period, right?
That's correct, you are. And you will also get a lot of notice ahead of time by correspondence. Through
which I'm sure they're required to do, right?
Absolutely. And so that all brings you into a special enrollment period. And S.H.I.N does a lot of stuff with those types of, when something happens. We had a couple of Advantage plans this past year that went
belly up.
Yeah, belly up is right. And so we help folks through that special enrollment period. Other kinds of special enrollment periods you could have is, well, say you stopped working, or you are now a widow or widower. Different thing, you know, maybe your spouse stopped working and now you don't have insurance, whereas before you did, so you might need something different. All those kinds of things are special enrollment things that you can go ahead and take a special time out to get your plans where you need them. Other than that, we're heading into open enrollment, which starts October 15th, goes through December 7th. And that is a period where people can change their Advantage plans, change their drug plans, and which is a good thing to think about, because every year you really ought to look at your insurance to see if you're still as healthy as you were, in the same place, can afford the same thing. A lot of the Advantage plans cost you nothing more than the $104.90. A lot of them. That's not saying all, but really a lot of them.
And you have new providers that come into your area too each time. So if you have an opportunity to go, and I was talking to Bill Turdette, who's an AARP representative, and Bill knows all of this stuff. He's been trained up the kazoo with it. Hi, Bill, and hi to your wife. Hope she's doing better. But he said that even though he has a great plan that he's been a part of, and those who've been a part of some plans years back, they have some of the best plans possible, and they don't offer. There's some they don't even offer anymore. If you've got that, you know, think twice about changing. But what he does is he goes to, when there are, during the open enrollment period, when they do different groups have workshops and the like, you know, they'll invite you in for donuts and coffee and all this kind of stuff. Go and listen to what it is that they're saying, because who knows, that might better meet your needs today than it would have yesterday.
Right, and there's so many incentives with the Advantage plans, because they're all vying for your basically your money, and so they've come up with all kinds of things that, like the health clubs, like some of them even pay you a certain amount every month for over-the-counter meds or whatever you would get at a drugstore, aspirin, vitamins, whatever. They'll give you like a chit or some sort of thing you can take to the drugstore and turn it in for over-the-counter meds or over-the-counter whatever at the drugstore.
And we were talking too about the difference between there are deductibles and there's co-insurance and the like. And sometimes, you know, as people are comparing things, you wonder what that means, especially in terms of the co-insurance.
Well, the deductibles are easy. They're what you have to pay or meet before the insurance kicks in. That's real simple. Part B deductible is $147 this year. So until you've paid $147 out of your pocket, you're not going to go to the doctor for free. You know. So
now, is that just with the original?
Yeah, that's just the original.
Because your Advantage plans,
you're not really,
there'll be maybe nothing,
right?
Or there may be $50 or whatever.
Right. Yeah, it could be, but those would more likely be co-insurance, more likely. But then as far as Part D plans I wanted to mention. Sometimes they have 0 deductible, and sometimes they have up. They can go this coming year. They'll be able to go up to $310 deductible. So before you get the first medicine that is not costing you anything, you're going to have to pay $310 out of your pocket,
Mm-hmm.
plus of course the premium.
Mm-hmm.
And there are drug plans that are very low cost. I've heard of one that's gone down this year, went from $18 down to a little over $12 a month. Really, there's no reason to not spend $12 a month on a drug plan.
Absolutely, which can save you a whole bunch of money
Sure.
out of your pocket.
Sure,
Yeah.
because a lot of the, mostly what they'll have is they'll have the generics and they'll have your other things, but you can, when you do get a plan, you want to know, and this is where one of the things where S.H.I.N.E comes in, is that if you tell us the medicines that you take, we can show you which companies, which Advantage plans
actually
have
cover it.
all your drugs on the formulary, how much it's going to cost you for the year's worth of drugs, and if you're going to go into the donut hole, which we haven't talked about yet, but if you are going to go into the donut hole, what month you're going to go into it. So at least you're kind of prepared for what you know is coming.
Mm-hmm.
So that's all good information that we can give you. And it also, we can compare at one time 3 Advantage plans side by side. We can tell you, yes, your drugs are on the formulary, or no, not all of them. We can tell you this plan is rated with 4.5 stars, and this plan is rated with 2.5 stars.
Mm-hmm.
What do you think? You know,
Yeah, the one I signed up for is 4.5 stars.
There's a lot of.
I think they're the best.
I don't think they have any 5-star yet, or we might have just gotten one now. But the 5-star, originally last year there were no 5-star in Florida.
Yeah.
So
Florida Healthcare is 4.5, or they might even be. I think he was telling me they actually went up. Last year it was 4.5. I think they may have gone up even from
they
there.
might be one of the ones.
Yeah. Fantastic. Now, and the other thing, comparing too, in terms of copays.
Right. Yes, and it shows all that. All that information is readily seen side by side on the computer. On the computer screen, you can look and see which plan looks best to you. You know, maybe the deductible is higher, or maybe the out-of-pocket expense is higher. There's different things that people value, and so what I might choose for me, you might not want for you, even though, to my mind, it's the best policy. But you know, something might be different for you, just in your experience.
Right.
Just in your own experience, you might think it would be better.
And what I was sharing about, if there are certain doctors you have and you want to keep those doctors, and you know, there are people who talk about, I'm just going to go to the ACA, the Affordable Care Act, where people say you got to drop your doctor. Not really. You know, if you've got an insurance plan that's working for you, you're actually able to keep that insurance plan. Costs may go up or down. For the most part, they're saying they're going down in many areas, but if you want to keep your doctor and you want to go on another plan, you just check to see which one, you know, has that doctor. And for a lot of these plans, you do have a lot of the same doctors.
Yes. For when the 2 kinds of Advantage plans are HMOs and PPO. Basically, there's a few other things that are a little bit different, but basically you've got HMOs and PPOs. And the HMOs are a certain group of doctors within
a network, right?
Right, like Florida Healthcare is. They have a network. It's a good-sized network.
Yes,
but
it is.
It's basically Flagler and Volusia County. So if you don't plan on mostly being in Volusia and Flagler County, you wouldn't want to go with Florida Healthcare. And I've seen big ads in the paper about them saying, and which is a good thing for them, saying that you can go out of Volusia and Flagler County, and we're still going to take care of you. That was a good.
Or you travel overseas, you still got coverage. Yeah, it is.
Not overseas.
Not
overseas.
Yeah.
Medicare is only good in the United States.
Right.
Yeah.
But I'm saying that if you had an emergency over there, that they're going to, we're not saying Medicare, but they will take care of you.
Yeah. So, but that's all important. That's all important stuff, and I was glad to see that they made that clear, that you know that you would still be treated, but it's a little bit different. It's a little bit of a procedure, and if you want to stay with Florida Healthcare, that's That's the price you pay.
Yeah, absolutely.
But
because if you live primarily in this area,
Right.
then that's where you want
Makes
to get your
sense,
health
yeah.
insurance. But
Right.
if you actually live primarily somewhere else,
then
that's yeah.
And if you're one of the visitors that we have, people that live half of the year or part of the year here and part in another part of the country, then it's a good thing to get a PPO. Especially one of your great, or even an HMO that's a great big conglomeration, a big network, because like Humana, like United Healthcare, Blue Cross Blue Shield, there's a whole slew of them. But that's the kind to get if you're going to be all over the place in the United States.
Okay.
So those are the kinds of things that we as S.H.I.N counselors are asking you. You know, are you here all the time? Are you here part of the time? What do you like to do? Do you want to go traveling abroad? Because that's something that a lot of people don't know. That Medicare is only for the United States, and the only exception to that I'm aware of is if you are traveling by car. This is so interesting. If you're traveling by car to Alaska, you have to go through a part of Canada to get there, and you are covered in that part of Canada.
Just that part.
Yeah, and that's just because there's no other way to get
Yes,
there.
right.
You know, so,
Absolutely.
So, but I thought that was very interesting that that's how you're. You know, other than that, and you'll see some the supplement plans will say emergency care for foreign travel. What they mean is emergent. In other words, if just to get you stable.
And get you back over here.
Well, you're going to get you back over.
Yeah, you'll get you back.
But yeah, only to get you stable. That's all that is. So if you're going to be out of the country, you probably want to get travel insurance or some kind.
Oh, absolutely. That's another subject, but I even heard of people who die in another country, and it's hard to get your body back. So you want to make sure that you can cover all of that. Now, hospitalization, in terms of hospital coverage and the like.
Are you talking compare the Advantage plans and the Part A?
To help people understand what's actually covered, because up front, when you first start out, you may have to pay a few $100s, right? Or no?
If you have
which plan?
If you have regular Medicare, you're going to pay a deductible up front the day you come to the hospital. Basically, I think this year is $11.72 that you have to pay as your deductible. Now, if you're in the hospital for say 5 days, they release you. You are out for maybe 70 days. And you have to go back in the hospital, you're going to pay another $11.72 because that's out of your benefit period. So that could happen to you several times if your health was bad that year. That could actually happen several times. If you had a supplement plan that would pick those up. With the Advantage plans, each Advantage plan has their own idea of what they want you to pay per day, but it usually doesn't amount to any more than that, $11.72. But what they'll do is they'll say $295 for the first 5 days. Okay, basically not doing precise math, but approximately $1,500 if you were in 5 days. But say you're in 2 days, that's $295 times 2, not $11.72. So, and most people aren't in the hospital for 5 days unless you're really, really sick.
Absolutely.
So it's in a lot of ways it's better to have it that way, and at least you know that's all you're going to pay after that 5th day or 7th day or whatever their plan calls for. Then you're not going to pay anything.
Right.
So it's quite equitable, I think.
Yeah, it's around $200 for one that I know of. For the first few, and there's a limit, isn't there? With the original, there's a limit as to how long.
I think it's 90 days.
Yeah.
I think so.
Yeah.
But there's other things like reserve days, lifetime reserve days, which are a little bit different. But yeah. We hope we ever don't get to that point.
I know. Now, I want to make sure we cover all of these now. Let's see, did we do that about the Medicare and the Medicaid, how sometimes that does go together. Hospital stays.
Remember we wanted to talk about that?
Yeah.
If you are unlucky enough to have to go to the hospital, it is really something that you should find out is, are you there being observed? Are you under observation, or have you been admitted to the hospital? And it matters because say you're the first day you're under observation, and you spend the night. You don't look any different. You don't receive any different care than somebody who's been admitted to the hospital. So you can't tell by how the bed you're in, or how many times the nurses, or how many times you get woke up in the middle of the night. None of that stuff matters. It's whether your doctor has admitted you under observation or as an inpatient. And what happens if, say, you went in and now you need to go to a skilled nursing facility. If you haven't spent 3 nights as an inpatient and you go to the rehab facility, they are going to charge you for it because you have to be 3 nights inpatient to qualify for skilled nursing facility.
Oh.
So if you were under observation the first night, second night and third night you were a patient, and you thought everything's hunky-dory because you spent 3 nights, you're going to be wrong, and it's going to cost you.
And out of money.
Yes.
And I've heard, I don't know if that's still the case, that even for people who end up going into the emergency room or whatever, be careful of how the doctor puts that down in terms of your diagnosis, because you might end up, just like with that, not being covered.
Right. Well, emergency rooms are always a hard, expensive way to go anyhow. You've got so many urgent care facilities, and they're so much more reasonable, don't have near the volume of people, and it's just
that's what I usually do.
Yeah, me too.
Yeah, you're right. The volume of people, and the people are there, and they have the time to really kind of pay attention to you. You aren't waiting as long, and all this kind of stuff. So it truly, truly, truly does make a difference. And we already said that there's no coverage, and if it is, it's extremely limited in terms of dental, vision, and hearing. So you might want to get supplemental on that. And we mentioned about saving your correspondence. You need to save all of your paperwork.
Yeah, that's a really good thing. I've found so many people that haven't kept things, and it even matters, I was telling Gwen, it even matters what color the paper is that your letter is written on. If you take a purple letter to the pharmacy, they're going to know it's something about your drug plan. So while it sounds silly, it's important to actually keep that piece of paper, because you can be talking to somebody and they say, okay, what color was that letter? It was tan. Okay, well then that means blah blah blah. So and there's probably about 10 different colors. So they all matter. They all matter. So you should keep any correspondence that comes from CMS. And I had somebody the other day that did not know CMS was Medicare. So just in case anybody's out there doesn't know, CMS stands for Medicare. It's the Centers for Medicare Service, I believe.
Yeah, because CMS, there is one called Children's Medical Services. Yes. Oh,
but CMS stands for is
Center for
the Medicare
Service.
Yeah.
Oh, okay. All right. Wonderful.
And they thought it was a scam because it came from CMS, and so they were real concerned about it, you know.
Now you also asked me to let's see, make sure that we cover. I know we did that one. Well, we want to get back to the fact that volunteers are needed for sure.
Oh yes.
Right.
Big time.
And the donut hole.
Oh, the donut.
Yes, the donut hole.
The donut hole. I do get a lot of questions about the donut hole, and it is going to be gone as of 2020. But right now we're still dealing with it.
And each year it goes down.
It goes down each year. Yes. What happens is, and this is 2012 issue costs. The first $2,930 is, and that includes what you pay the pharmacy and what the pharmaceutical company pays. So if the two of you together, the cost of the medicine. So don't think, oh well, I only get $4 medicine, so I'm never going to reach the donut hole. Well, maybe not, and maybe yes, because it depends on how much that $4 medicine actually costs. So they add all that up.
So it's the total cost that counts toward the donut hole.
The total cost, yes. And then when you reach $2,930, you are in the donut hole, or the coverage gap, until you get to, and like I said, this is this past year, $6,658, and that is you alone because you are going to pay during that coverage gap. You're going to pay a big percentage of, I think it's close to 50% of the brand names and 72% of the generics. Well, the generics aren't real expensive, so
Right.
you can afford to pay more of them. But once you reach that $6,600 approximately, you're what they call catastrophic coverage, and then it's going to pay almost everything. So really, it's not a great thing to get to catastrophic coverage, but at least it gets you out of the donut hole. And I had somebody explain to me, and I thought it was a cute way of explaining it, that it's like the donut hole and the catastrophic coverage and all is like getting married. It takes two of you to get married. It takes you and the pharmaceutical company to get to the donut hole. When you get in the donut hole, it only takes one of you, and that means you're paying it all yourself. And so it takes, but it only takes one to get you out in divorce. So that's how they explained it. It makes sense to me anyhow. So, but that's the donut hole, and so hopefully nobody gets in it. But if you have S.H.I.N E, look at your meds and give you a cost out. You'll know if you're going to be looking at a donut hole, and then you can do something proactive, like maybe you can talk to your doctor and see if he or she can give you samples to cover you through that time, or give you the information about calling or getting in touch with the pharmaceutical company. Lots of times they have assistance programs for people who get in the donut hole, or low-income people, things like that. Or the doctor might just, be able to transfer you to a lower-cost medicine that won't be so expensive for you.
Right.
So there's a lot of things you can do to get in the donut hole.
And just as the donut hole is being reduced, from what I gather, the cost of even generics, as cheap as they are, that's supposed to go down as we go forward as well.
I believe so.
Yeah,
a lot of them are $4 and a lot of them are $0.
Yes, absolutely. In fact, some of I know Publix for a while there was doing some special
does,
thing.
Antibiotics, and I understand from somebody recently, I think they do blood pressure as well. And Walmart does $4, a lot of meds, $4, a lot of them.
And I think even Walmart was doing
That's what I'm
something
saying,
with,
yeah.
Okay, all right. So shop around, get the information, contact S.H.I.N if you got questions, and because that's just so key and important. And as I started out saying, healthcare it's just a very personal issue. That's why we got so much in terms of Obamacare and everything else, because it is so personal. And just as you've said, in the past, when Medicare started, we had similar kind of upheavals. And, try to take somebody's Medicare away today, okay? And, even in terms of Social Security, and try to take somebody's Social Security away today. We go through these things, and it's not because people don't care. They have their own certain ideas about what should and should not be, but the bottom line is that all these programs end up helping people, which is the case with Affordable Care and Affordable Care Act as well. Now, events coming up.
Okay, in the main thing I'd really like to mention is the one that's happening at the Aging Tree on the 19th of this month, which is a Saturday, and it's from 10:30 to 12:30. We're going to have probably two speakers on each subject, on Medicare and open enrollment, and the Affordable Care Act. So we're going to have two different presentations during that period of time, and it's strictly for education. There's not going to be anybody there. There's going to be insurance people there, but they're not supposed to talk about their companies. They're talking about just general.
And where is that located?
The Aging Tree is in Orange City. It's a beautiful agency. It's a one-stop shop, basically. They've got an elder attorney there. They've got hospice care. They've got respite. They've got homemakers. All you name it, they've got it. And they're very big on this educating people and everything. And it's at 985 Harley Strickland Road in Orange City, and that is in the Kohl's Shopping Center. It's Suite 100 in the Kohl's Shopping Center.
Okay.
And I'd be very good that day.
Ah, wonderful. And that shopping center, I think is right up from the hospice.
From
Halifax Hospice, I believe, isn't it?
I don't even know that. I know it's almost across the street from the hospital.
Okay.
In Orange City.
No, that's where it's I say right up. It's like you're hitting Orlando on I-4, is right up. And close to, it should be really almost across the street from then, the Walmart, Super Walmart.
Yeah, it's kind of catty-corner.
Yes, yes,
But
okay.
that whole shopping center is huge.
Yeah, I know. I've shopped there too.
Yeah,
You
me
know,
too.
Orange City. I'm from Orange City, so I used to go there an awful lot when my mom was alive. But anyway, I still go at least once a month. So for someone who would love to volunteer for S.H.I.N E, and tell us again what S.H.I.N E stands for, but if they would love to volunteer for S.H.I.N E and contact S.H.I.N E, give us that information again.
Okay, S.H.I.N E stands for Serving the Health Insurance Needs of Elders, and as I mentioned, we also help people with disabilities that have Medicare as well now. There's no particular, you don't have to have a particular amount of education or anything like that. The training is a half a day of orientation, which you can do at home on your, you can do it by computer.
Mm-hmm.
And then it's 3 days, now it's 3 days of training, and it is intense training. It's a very good training. You do need to know how to use a computer. That doesn't mean you have to be a whiz, but you have to know how to use it.
Mm-hmm.
And it's very helpful if you have a computer as well. We will help you with phone things. If you need a track phone, we'll supply you with a track phone. Mm-hmm. Even though we're volunteers and we don't get paid, we are reimbursed for our travel. So that kind of takes the sting out of when I have to go thousands of different places in Volusia County.
And for those who don't want to do that and would like to just work off of their phone, they can do that as well.
Yes, you can.
Yes, yes.
In fact, I have one lady right now that's in New Hampshire, and she is helping me cover Volusia by phone. And when she finds somebody who wants face-to-face, then I'll contact them and make an appointment.
Yeah, someone.
So,
Yeah.
but there are literally all kinds of things you can do. If you're comfortable with the phone, if you're comfortable with clerical stuff, you name it, we could use you.
Mm-hmm.
And all you have to do is use that one Jacksonville number that I gave you, that 888 number.
Yes, and I put it. Yes, the 1-888. 242-4464. That's the Jacksonville number. 1-888-242-4464. Call them direct, and is that Elder Source?
Yes,
and they have S.H.I.N volunteers there as well.
And they will ask you, your phone address, and they can send you an application packet. And then once you've sent that in, you can pretty much expect a call from somebody, so they would interview you just to make sure that you understand you can't be an insurance agent, for example. There's some things that are conflict. You're going to need to go through a fingerprinting and a background check. That's all paid for by S.H.I.N.
And all of this information that you get is confidential. It's treated as confidential, and it remains confidential. And you have to be willing to abide by that. Just so people know that these individuals, that even when you call into them and request information, they will give you that information, but everything's treated confidentially. And a great resource. It really helped me with my decision, even though I didn't call anybody direct, but I had already gone through some of the training, so I had a little of that and a little of this and a little of the, and you get to the point where you are able to go ahead and make a decision. But fear not in terms of this, because if you make a decision regarding something about your Medicare plan, as long as you've gone ahead and you haven't put yourself in a penalty situation where you didn't take B, and if you were doing the original, you didn't take B and you didn't do what you needed to do to make your contacts to select a provider for D and the like, or maybe you went into an Advantage plan where you didn't have to worry about any of that. But if you didn't do that, you got penalties involved. But if you did go ahead and sign up for everything, or you sign up for an Advantage plan, and you want to change, there are set times that you can disenroll, and I think in the beginning of the year there's a disenrollment period.
Yes, there is.
I was told that by the person that I talked to. So they even, you get, and these companies are required to give you this information. You can't, you go to one and they're going to tell you something, you go to another. they're required to tell you all of this information, just like the Affordable Care Act. They're all required to tell you, you know, what's what. And but if you missed it, or you signed up for something and you found out that, oh, that wasn't the right plan, then you've got a time for disenrollment, but you've also got an open enrollment period, just like what's coming up, and what we're actually into, the October 15th coming up, October 15th through December 7th, which is sign-up time for, and the new people, it's 3 months out from your birth date, your birth month, and 3 months after. You have that 7-month window to sign up, but the earlier you do it, the better, and the greater chance that it will start the first day of the month of your birthday. Okay? Anything we haven't shared? Because you talk with people, you guys, you talk to elders all of the time. You know some of their issues, some of their concerns. We've tried to, and I said to begin with that this is just the tip of the iceberg in terms of everything that you might have a question on or you want to know, because, you know, healthcare is important, it's personal, it's heart-wrenching. I had sleepless nights really trying to decide, what am I going to, which one, but once, you know, I started talking to the right people, everything started falling into place. That will be the case for you too if you contact S.H.I.N.E, and they can answer your issues, your concerns. They won't tell you what plan to go with. They'll give you the comparative information and other information that you need so that you can make the right decision, but that decision and choice is yours. And if you make the wrong decision, you know, you can come back and correct it, but some things you'll be penalized for because you didn't, you know, like Part B. If you didn't sign up for that when you had the chance, or allow that to go through, because you didn't have to sign up, you allowed it to go through, then there are penalties involved in that. And as we said too, in terms of Part D, there are penalties if you didn't get that, unless you went to the Advantage plan, and normally they have that included as a part of their service. So, you know, you can tell I've done a lot of research on this stuff. You really have to. You really have to. And for all of you who have more questions, more issues, again, this recording will be on YouTube within the next 2 days. But feel free to, again, contact S.H.I.N.E so that if you have questions, they can give you the information that you need so that you can make the right decision. And I keep covering up that card with the number, the 188, you know. Oh, I wrote it out anyway. 1-800, there's a 1-800 number, 963-5337, and that's the number that will get you to a calling center, yes, and then based upon the first 3 numbers, your area code, they will direct you to the area where you reside, where they have S.H.I.N.E volunteers. Or you can call directly to Elder Source, and that's 1-888-242-4464, and they will, you know, you can go there to sign up for S.H.I.N.E to be a volunteer, or you can go there, and they also have people, you know, working there who will be able to respond to your queries and your information as well. Oh, you know, it's tiring, isn't it? Oh, and listening to your schedule, Judy, I mean, goodness gracious, wow. I see why you're coming off Elder Source Board. You don't have any time, goodness gracious. And shout out, you know, I did a shout out to those who are enrolling in the Affordable Care Act, the Patient Protection Affordable Care Act, Obamacare, and those that are helping them to enroll. But I do have to do a shout out too to the S.H.I.N.E volunteers, because there's a lot of information you have to know, a lot of updating that occurs as well. And these volunteers are there for you, and they're, you know, they don't tell you what you must do, they just tell you what is important to do. You know, make your decision as to who you're going with and all that kind of stuff. That is your decision, but they give you the information, give you the information and refer you to places where you can get even more information to make the decisions that you want to make. There's a lot to this stuff, but I'm glad that I have gone through it, and I'm done for now, at least for until I don't think I'll be doing anything for disenrollment, but you know, till the next time comes around, I might help my Advantage plan, I don't know. But But there's just so much out there in terms of care, you know, providing health care for individuals in this country, and is completed or made broadened by the Affordable Care Act. And we know there's still some people that will still be kind of left out, but that's okay. We'll get you guys the next time around. It's important that you take care of yourself. Wouldn't you agree? I mean, depending on how well you take care of yourself, that will determine what kind of lifestyle and life you have as you get older. And if you haven't done it, you know, then you know that you need even more coverage as you get into your later years. I was telling someone today, Judy, that my mom had told me, because I was saying I have to have my glasses now every time I pick up something to read. And she had told me, she said, we used to joke about her, give me my glasses so I can see, you know, we'd laugh and stuff like that. She said, that's okay. You just wait. Time will catch up with you too, and you'll understand, you know, what it is that I'm doing in terms of having to get glasses to read or having to do this and can't walk as fast, you know, keep up with you guys and all this kind of stuff. And that's true. Time is a great equalizer.
Yes, it is. Yes, it is.
Oh, goodness. Any final closing comments that you want to share, Judy?
The one thing I thought of was the fact that one way that you can tell that you're in an Advantage plan, because I ask a lot of people and they don't know whether they're in an Advantage plan or not. When you go to the doctor and you have to show a different card than your Medicare card, you're in an Advantage plan. If you show your Medicare card, you're under Original Medicare. That's the one way that you can tell.
Okay, and that's a red, white, and blue card.
That's right.
But the Advantage people, Medicare Advantage people, will tell you that you can put that card away.
Yes, you can.
And they will give you a card that you will use and show when you go to different places.
Just don't throw it away.
Yeah, yes, and we want to make sure too that you make a copy of that card and you protect that card. Because that card, you know, and I just went through some training for fraud, and that card, that information, your social security number, your birth date, you know, a lot of that stuff can hurt you in terms of identity theft. So you do want to make sure that you protect your personal information, okay? And nobody should be calling you and asking you to give them your personal information, like banks and the like. Just for a heads up, because they already have your information, as they were saying today. And they will tell you that they do not do that. Neither will they go online and give you and ask you for your information online. So if somebody's asking you for that kind of stuff, you need to just hang up and then call your company or the people directly yourself. All right? Okay, it's been great. It's been awesome. Goodness gracious, you can tell there's just so much. But thank God that, number one, we have health care coverage opportunities available to us. Thank God we live in this great country, United States of America, where those opportunities are made available to us. And it's not dependent upon whether or not you're a wealthy person or whatever, as to whether or not you have health care. There are health care opportunities out there and available for you. You just have to know where they are and check them out. And contact S.H.I.N.E, okay? You've been listening to Truth with Gwen Azama-Edwards. My guest, of course, Judy Hahn, coordinator with the S.H.I.N.E program and volunteer for Volusia and Flagler County. And be sure to, you know, go to the website, www.gwen-truth.com, so you can access all these important, you know, the videos for the current show and other shows, and access contact information as well, because we have that also on the website, www.gwen-truth.com. Until next time, be informed, be empowered, stand tall for that which is right and truthful. And I know you can tell, listening to Judy Hahn, that she stands for what's right and truthful, as do I, and so do you. You continue to stand. Keep standing, okay? And again, this has been Gwen with Gwen Azama-Edwards with Truth. And you be blessed and have a great and fantastic week. I tell you, life is awesome, just awesome, and so great and beautiful. Even during your worst days, just take a moment and look at the beautiful sky. And even if it's raining, understand that rain, you know, is a sign of blessings, because without the rain, how would things be, right? So you have a beautiful, beautiful weekend. God bless, and we'll see you next week.
Truth with your host, Gwen Azama-Edwards,
Right.
exclusively
Wonderful,
every
wonderful,
Thursday
wonderful.
night on
I probably